I think it was worrying at the beginning because nobody really knew what it all entailed. But I think once we got into it and you saw the patient, we did have some quite poorly patients. It was fine, we all just cracked on and it was all okay.
We can't thank them enough. They always had a smile on their faces. Nothing was ever too much trouble, whether or not we wanted to FaceTime or whether or not we wanted to ask questions, whether or not we wanted to speak to the A&P or the medical staff. They were all quite polite, very courteous, and always answered our questions to the best of their abilities.
A lot of donations as well for staff, hand creams and things, so that's all been nice. So just little bits to say people are thinking about us, so yeah, it's been nice. And we filled up very quickly. We started off with about 18 patients and then suddenly went up to 28 beds in a very, very short space of time. And the majority of the patients were very sick.
Patients with COVID are very unpredictable, which is very different than what we prior to COVID would be getting through the doors. So adapting to those, that unpredictability, providing that care, dealing with PPE, especially during the hot months, which was even more difficult, and just the relentlessness of it every day, having to work in challenging conditions with patients with a much higher acuity, increased illness and dependency.
The majority of our patients have been very, very ill but have become well and have actually left and gone back to their own homes, which I think is a great achievement by everybody.
It has been tough, but everybody here has pitched in together and works incredibly flexibly. The care that they have delivered in the situation that they've been is phenomenal. I'm so proud of everybody. So I want to thank everyone that works on the wards and everyone that has sent any thank you letters, chocolates, biscuits, anything. Really thank you. It is much appreciated because we are working hard and we have been, and it's because we care.
Scary at times, emotional, very emotional. I just long that with the support of each other, I think, and the love and people in general, public bringing goodies and things in and help lift morale, and we've got through it.
I think particularly the ones that have been so unwell, and it's, we've had moments where we thought they're not going to pull through that, and we've had a lot of them, particularly over, December, January time. There were a lot that we didn't think were going to make it, and they have. And to see them actually go home and look so well, I don't think there's any better feeling than that. It does make all the stress and the intensity worthwhile. It's why we're here. It's what we do.
Yeah, it's been a real experience, and I really feel proud to have contributed, to be honest, and very emotional as well at times.
I think majority of people have had their vaccinations now, so even though we're still getting some positive patients, they tend not to be as sick.
We can't thank them enough for what they did for us. They were just simply the best.